Hello, everybody, and thank you for joining us today. We're just going to let people trickle in from the waiting room. And as we get started, we have a poll for you today. We are interested in how many people joining us today have ever used their family leave benefits before. All right, and we'll see how that comes in, and we'll set up our first speaker with those results. Okay. Thank you for joining us. I'm Kathy Rowe from New Jersey Advocates for Aging Well, and this is the third in our series of caregiving in New Jersey, which is an important topic for all of us. As we know that our population is aging, not only are more people older, but people are living longer, so they are older longer. The need for caregiving is really increasing, and at the same time, where we're facing a shortage in home health aides who can help provide some of that care, more and more responsibility is falling on family caregivers. So I wanted to, before we get started, share some upcoming events with you. We'd like to thank Parker Life for sponsoring this series, and also want to let you know about a program they are having next week on managing money, a caregiver's guide to finances and legal considerations. It's on Tuesday, March 21st from 4:30 to 6. And if you are interested in joining this program, I have at the bottom of the flyer there the RSVP information. I will also be emailing that out to all of you after this. You'll get it by the end of the week in your inbox. So we encourage you to join Parker at that. And we also have, this is going to take me a moment to find. We also have an event at Parker, an open house from their adults daycare center, a new facility they have open. So we will send that flyer and information to you also. Okay. So we have, with 20 responses so far, only 25% of the people with us so far have actually used family leave benefits. 75% say they have not. So with that, I'm going to take that down. And we're going to start off with our first speaker today is going to talk about family leave benefits. So I'd like to welcome Lauren Levant, the Vice President of Human Resources from Jewish Home Family. And she is going to cover this. If you have questions, please put them in the Q&A and we will get to them. We're going to try to save them for the end, but if it's very relevant to what our speakers are talking about, I will jump in with them. We will get to all of your questions. So please, whatever it is that concerns you or you want to learn more about, please put it in there. Okay, Lauren, if you click on slideshow, then we can see it bigger. And then do from the beginning on the left.
How's that on your end?
Perfect. Take it away.
Wonderful. Thank you, Kathy. As Kathy mentioned, my name is Lauren Levant. I'm the Vice President of Human Resources for the Jewish Home Family. So I was asked today, of course, to talk about the FMLA benefits. I hope with the numbers of the poll that Kathy just did, I guess another poll would be great is how many people are familiar with their rights under the FMLA. So maybe we can look at that another time. But FMLA is a federal law that was enacted to protect employees' job and medical insurance when they need to take unpaid time off from work. This is something that is not new. This is something that has been going on for over 30 years now. And I do have to say FMLA, it is not just complicated for the employer, it is even more complicated for the employee, especially depending upon what the reasons are, just adding other stresses. So our role as HR really is to help be your partner and navigate you through the process. So FMLA is those who are covered for it. It's for employers who have 50 or more employees. And you can use it for a variety of purposes, which we're going to go through. I'm sorry. Hopefully many of you are aware of your rights as well. Wherever it is that you work, you should be seeing signs throughout your workplace, especially in the HR office, that explains all of the rights. But we are putting this kind of in a more compact version for you. You do, to be eligible for FMLA as a full-time employee, you do have to work for at least 12 months. Some employers, they may have it, their rolling year could be different. So at the Jewish Home Family, an FMLA period is starting from when the person starts using their first FMLA benefit day. If someone is out, for example, for 12 weeks, they can start accruing time on day one of returning to the place of business. Does that, if maybe Kathy, Jennifer, Ellen, if you can tell me if that makes sense? I know I can't hear questions just yet. So
No, that makes sense. So if anybody does have questions, put them in the Q&A or the chat. The chat wasn't working last week. I hope it's working today. And then I'll jump in for clarification, Lauren.
okay, awesome. So if you're a full-time employer, you work for a year, you are eligible up to 12 weeks of a leave, and your job will be protected. If you are on the health insurance, so you have a couple of choices here how to handle that. If you're taking your benefit time while you're out on leave, your health insurance contribution can be automatically deducted according to your payroll organization. If you do not have any benefit time, you are still eligible for those 12 weeks. However, if you are on the health insurance, you may have to still make your payroll contribution. But before you start your FMLA time, you should be connecting with HR on this. Connecting with HR at all times is really, really key here. Not your direct supervisor, it must be HR. And I'm sorry if I sound repetitive on it, but HR is really the one who is crossing the T's and dotting the I's. So many people are confused also sometimes as to what qualifies reasons for an FMLA. So it can be for the birth or adoption of a child. It could be for caring for a family member with a serious health condition. It could also be for yourself, for your own serious health condition. It is also qualifying for military service. So many people don't always understand that with FMLA, they think that it may be for themselves, it may be for their child. But if you are the primary caregiver for your parent or your grandparent, you absolutely are entitled. If you are that main caregiver, you are entitled to the FMLA leave.
Lauren, we
Yes.
do have a question. Can you apply for a FMLA after unemployment ends?
Unemployment? No.
Okay.
Do they mean unemployment or are they talking about disability?
Let me see. It says unemployment. So if you've been on unemployment, after that, you can't apply for FMLA. You have to be currently employed.
No, because if you're on unemployment, that means you don't have a job. So that's why
Okay.
you can do something with disability. You can be on FMLA and you can file for disability. The only time that there would be that interruption is that if you're on FMLA and you are still getting paid from your accrued time, disability will not be paying you.
Okay.
Okay.
All right, thank you.
So let's say you're on FMLA. You have, let's just say 4 weeks of time, but you're still not ready to come back. Once your 4 weeks of time has stopped, then you can file for disability. You'll get paid from disability and still have the additional 8 weeks of FMLA time, which protects your job. Did that answer the person's question?
I think so. If there's more questions, put them in the Q&A. Thank you.
Okay. So the next question then is that what qualifies as a serious health condition? It could be based for an illness, an injury, impairment, and also whether it's physical or a mental condition as well. But again, both physical and mental health conditions do qualify for the FMLA leave. Here's the trickiest, believe it or not, of the FMLA leaves, and that is the intermittent leave. The intermittent leave means that, let's say you are providing care for a family member and you have a brother or a sister who is sharing that responsibility with you. So let's say you need Monday, Wednesday, Friday off, and you have a sibling who is taking care of your family member for the other days. You are able to do it that way, but it becomes very important for the employee and the employer to track this intermittent leave as accurately as possible. There are also times with the intermittent leave that you can just say, I need 3 days off, throughout the month. Again, it all comes out to tracking. And the communication, I'm going to say this a lot, communication is the most important piece here, because if you just tell your supervisor what you're using, what time you're using, please do not expect that all that information is going to get to HR. 9 times out of 10, it is not going to get to HR. So it's really important that the employee communicate with both your supervisor and HR at the same time. Military leave, I'm gonna leave that up there. Although you can, if you're a caregiver of someone in the military, that does allow you to take time off as well. But I think this is more talking about our seniors. Okay, but I'm sure Kathy can share this slide also if anyone is interested. So job protection, when you go on FMLA, you are expected to hold the person's position. We do our very, very best always to hold the exact position, meaning the same hours, the same schedule, and of course, obviously, the exact same pay. If there's a reason that your job is not able to hold the exact schedule, they are expected to communicate that to you, within 30 days prior to your return. So the intention of FMLA is that you still have a job, you still have the same number of days a week, and that your salary or hourly rate is exactly the same. Sometimes exceptions to job protection. If you're a key employee, it may be denied for reinstatement if returning to them to their position would cause substantial economic issues. But again, something with that, when we're talking about key employee, we're talking about a department head, we're talking about a vice president of an organization. But again, that is something that also has to be talked about well in advance. You can't just return to work after your leave and find out you don't have a job. That won't happen. Paperwork. Okay. As soon as you are aware that you need to take your leave, you should be contacting your human resource department. There are FMLA there's paperwork that has to be completed. Sometimes you can, if it's about taking care of your family member, you can fill it out yourself and then get a doctor's note from your family member's physician that just, quantifies the leave that you're asking for. There are times, let's say someone's going in for surgery. A lot of times we're finding out now that the doctor will not fill out the paperwork until after the surgery is complete. And that is fine, but again, as long as you're keeping in touch with HR, so that HR knows exactly where you're at in the process. Once you submit your paperwork to HR, we are responsible for letting you know within 5 business days in writing if you're eligible for FMLA. Some of the reasons that would make you not eligible for FMLA is that if you have not worked a certain number of hours throughout the year, it could be that you've already used up all of your FMLA time during that. So you should be receiving something in writing from your human resource department within 5 business days of the initial notification. Okay, I'm not sure why this one is there, but there's a lot of different names on how people call FMLA. I guess that was more of a joke, but we'll move on. So this is just pretty much a layout of everything that I have said. The one thing I do want to go back to, and this just popped up here, employers can ask for a second medical opinion if someone is asking for an additional FMLA time. Sometimes you find individuals try to take advantage of this benefit. So if there is some red flags, the employer does have the right to ask you to get a second medical opinion. But we find very rare do we have to actually go through that process. And that's it. So I know it says questions, but we're waiting until after everyone presents. And I'll pass.
If anybody has it
Yeah.
now, there was another question about the unemployment. I think somebody had encountered an issue with that. So I will look that up, and when we send out the recording to everybody, we'll send the answer to the questions about unemployment there.
You can get the unemployment if you're on FMLA and you have no benefit time, and you do not necessarily meet the criteria for disability. You can file for unemployment at that point. How I took the question was that if someone was on unemployment first.
Okay. Thanks for clarifying. Okay. Thank you, Lauren. Now, if you turn off your screen share, we're going to go to Jen Rutberg. Are you up? Jen Rutberg is a caregiver program specialist with the New Jersey Department of Aging Services, and she's going to talk to us about the respite care program. You're on mute still.
Hello, everyone. Let me pull up my slides here for you. Thank you so much for having me. All right. Okay. As Kathy mentioned, I'm from the New Jersey Division of Aging Services, and I'm here to talk to you about respite, what it is, what services are out there that can provide respite, what programs can provide respite services. So hopefully this is nice and helpful for you. Please feel free to put things in either the chat or the Q&A about respite, and let's get going. So I come from the Division of Aging Services, just so you know who I am and where I come from. And every county in New Jersey has an office on aging. It's also known as the Area Agency on Aging, or AAA. Nothing to do with the car people. We are the state unit, and older Americans and state dollars go through us to those county offices on aging. And in New Jersey, every office on aging at the county level is also an aging and disability resource connection. So whether you're dealing with an older adult, whether you're an older adult yourself, or whether you're dealing with a person or are a person who is younger and disabled, you can always reach out to your county office on aging. Some counties refer to them as a Department of Senior Services or Division of Senior Services, Caregivers and Veterans, but there's always one in your county. So talking about respite. What is respite? That's a question I get all the time. Respite literally means a break. It's a break from caregiving. It's a break from the daily, weekly, monthly, hourly, minutely services that you provide, the tasks that you do, the incredible, they call it an intellectual burden, all of the thinking, all of those thoughts, trying to keep things organized, trying to keep things in your head, all of those items that go into providing care for another human being. And that can be any person who you are, friends, spouse, neighbor, significant other with. It's actually very surprising to me. With our programs, we have a surprising number of ex-spouses where they had an amicable separation and they're still providing care for each other. It's a real testament. There's a tremendous amount of caregiving that happens nationally, worldwide, and certainly here in New Jersey. About 20%, 1 in 5 adults is a caregiver. It's kind of amazing. There's a lot of them. So respite is that time away from caregiving, and it's time just for you so that you can take a nap, get your hair done, sit and stare off into space, do some exercise, take a walk, go to a medical appointment, or just do something that is not caregiving related, whatever that happens to be. And the idea of respite, the whole point of it, is to allow you to recharge your batteries so that you can go back to caregiving a bit refreshed, or at least a bit less run down. So what kinds of things are considered respite? Literally anything that gives you, as a caregiver, a break. So that could be the bubble bath, that could be a support group, it could be going to lunch with a friend, it could be as simple as a phone call. It could be just a simple, let me take a deep breath. Anything can be considered respite, whatever it is that's valuable to you to give you an emotional, physical, and spiritual break. So while you're getting that break, what's happening to the person who needs care? So a respite service is the care that is provided to the person who you are caring for in your absence. So that could be somebody else who comes into the home to provide care. It could be someone who takes the person out. And that could be for something as simple as a drive to go see the leaves in the fall. It could be for anything. It could be an inpatient stay for a short period of time, a few days, a week, in a care facility such as an assisted living, a memory care home, a nursing home, whatever level of care is going to be able to be appropriate for that person. It could be adult daycare. The person could go to day center for several hours during the daytime and then come home. And that can be respite for you. Campership, going to a camp, is also an excellent respite. We often think of campership as for somebody with an intellectual or developmental disability, but there's even a camp run by the Brain Injury Alliance of New Jersey for someone with a traumatic brain injury. There are a variety of different kinds of camps, so be on the lookout for them. And anyone can provide respite services. That could be a friend, a neighbor, a member of a club. That could be professional care staff, such as a home health aide. It could be a nurse. It could be whoever it is that's needed to provide appropriate levels of care for that person. So there could be trained volunteers, again, a care facility of an appropriate level, or a day center. I like to warn people, things can go wrong with respite, but there's basically 3 ideas that can give you a solid footing so that you can make respite as successful as possible, or at least avoid what can go wrong with it. For example, if the person or the facility isn't prepared for the kind of care, you need to be very clear and very detailed about what kind of care the person needs. Does the person need somebody with them at all times to get up out of a chair and to walk? Does the person have a lot of anxiety, and what helps to soothe them? Does the person need to be occupied at all times in order to be able to avoid anxiety? Or if left unoccupied, will they perhaps wander or become very upset? Those are just a couple of examples. Does the person need full assistance with using the bathroom? Do they need their food cut up? Do they need to be fed? If you put a drink of water next to them, will it occur to them to drink it? You can get very detailed with that because the job that you do as a caregiver is very detailed. Another issue is if the caregiver doesn't come back as scheduled. if there's no communication. A lot of times, particularly with inpatient respite stays, that can be adjusted. There can be problems with airplanes, especially in these days. But if there's no communication, that can be problematic. Also, if there's no emergency contact. So someone who is very familiar with this person's care needs can be the emergency contact so that you can go on your respite, whether that's going to get your hair done or going to the doctor's or going away, without worrying that you have to be next to your phone at all times. An emergency contact is really helpful. And what you can do to help it be successful is that preparation. Where possible, you want the person to know that you're not going to be there, but so that they can be confident in who is going to be there or where they're going to be. For example, if they're going to another place, such as a facility or a day center, if they could tour it, try it ahead of time. They need to have that reassurance, whatever means reassurance for them. It could be as simple as being told, hey, I'm going to be back at 3 o'clock, or it could be a safe blanket, or any other reassurance. Also, the people who are providing the care need to understand, again, what's needed, how it's needed, when it's needed, what that schedule is, if that's helpful for keeping the person from being upset or feeling distressed, and anything that's unique to that person. So there are a number of different programs that can provide respite, such as the statewide respite care program. And here on the slide are a variety of the requirements, but just in short, it's the statewide respite care program provides either short-term or episodic relief for that caregiver. And that caregiver needs to be an adult 18 or over. The care recipient needs to be 18 or older. And the idea is to prevent burnout so that caregiver can keep being a caregiver. There's some basic eligibility, financial, the age the person needs to be living in the community and have daily basic care by a caregiver who's not compensated for that care. So they're not being paid or compensated in any way. And they need to have some kind of a functional limitation that requires care by another person. That can include dementia care. And there are a variety of different services. These are just some examples, but it can get very individualized depending on what the caregiver's assessed needs are. Now, the care recipient may need a bunch of different services for their own care, but statewide respite is specifically about what is going to give that caregiver the best break possible. What about care is stressing out the caregiver the most? And sometimes it's something unusual. Alzheimer's Adult Day Services Program is similar. The only service that it does is adult daycare. That can be in either a medical or a social daycare. And that program subsidizes the day center services. And under that program, the person can go up to 5 days a week to a day center, which is really excellent, especially for a working caregiver. The person can be any adult age, 18 or over, but they do have to have that diagnosis of Alzheimer's disease or any related disorder, such as frontotemporal degeneration, mixed dementia, multi-infarct dementia, Lewy body disease, etc. They need to have that daily basic care by an unpaid caregiver. They need to live in the community, and there are income and asset limits. The applications go through the day centers directly. Every office on aging, those offices on aging at the county level that I mentioned earlier, also gets Older Americans Act dollars specifically for a part of the Older Americans Act called the National Family Caregiver Support Program. It's sometimes also referred to as Title 3E of the Older Americans Act. And there are a variety of services, mostly around support groups, care management, connecting to resources that are available. A number of counties also help to fund the Wander Guard systems or the Project Lifesaver. So any kind of a wandering safety system, but it depends on the county. So you want to talk to your Office on Aging. Now, there are several care programs that have respite components. They're not just devoted to respite themselves. The biggest one is the Medicaid program known as MLTSS, Managed Long-Term Services and Supports. Now, that's for somebody who's living in the community or in a facility who meets our nursing home level of care here in New Jersey, even if they're living in the community. And they have, under MLTSS, a very robust caregiver support program for both inpatient and in-home respite. And that's in addition to the care that the participant themselves has been assessed to need. And for the caregiver program, they just have to be on MLTSS. So their financial, clinical, those care needs and age and disability considerations for that. And in order to access that service, you just talk to the Medicaid case manager from that managed care organization, that HMO that's managing the Medicaid. And these are just some of the financial requirements. One note about MLTSS, something that a lot of people don't realize, is if you're over those income requirements, the person could potentially still go on to MLTSS if their income is higher, but they've spent down their assets on their care. A qualified income trust is a trust that you set up yourself at the bank of your choice and have the trustee of your choice. So that could be your spouse, it could be your adult child, it could be whoever it is that you trust. And the income that puts you over the Medicaid limit for MLTSS goes irrevocably into that trust. And then that trustee spends that trust money every month on your care. Because remember, in this case, your care exceeds your income. And so you've spent down what assets you had. So it's a really nice way for people with that higher income, but who have extensive care needs. Think dementia care, think any kind of extensive and expensive care needs, can actually still get their care and remain in the home or get facility care, whatever it is that they feel that they would want. So a QIT, or Qualified Income Trust, can be really handy. JAC is another program that has a respite component. JAC is primarily services, just like MLTSS, for that care recipient, that person who is participating and needs care. But if there is a caregiver involved who needs some extra time or an inpatient break, you can talk to your JAC care manager about respite services, about getting some additional services or an inpatient stay for a short period of time to give you a break so that you can come back and continue to be a caregiver who's supporting this person. And this is just some on the JAC eligibility. To access the JAC program, you go through that county Office on Aging. There's a PACE program in 7 different counties. We're looking to spread that. PACE has a respite component. They can give additional services to give a caregiver a break. And applications would go through the PACE site. So you can see there are a number of PACE sites. There is Hudson County, and then the rest are Central and South Jersey for right now. PACE is a partnership between Medicare and Medicaid. So any of the services that you would have through either of those programs, you get in a very coordinated way through the PACE. It's really a lovely program. I would suggest reaching out to it. It's a really unique and fantastic program. And then we also have a number of wellness programs that can be for you as a caregiver, and can also be for the care recipient, and that in and of itself gives you a respite or can make your caregiving job a bit easier. We have chronic disease self-management programs such as for diabetes and cancer. We have a lot around fall programs and balance. A lot of caregivers neglect their own fitness, their own health, or can be frail themselves. And if the caregiver falls or the caregiver becomes ill or has their own chronic diseases, and a lot do, about 30% of family caregivers don't get sufficient sleep. About 40% of caregivers have 2 or more chronic diseases. And about 33%, a full third of family caregivers, have also an actual disability of their own. So we need you to take care of you. So we have a variety of wellness programs for you as well as for the person you're caring for. And again, you're going to access those through your Office on Aging, or you can use the link here to our division. A couple of things in our proposed state budget that can also help out with respite. Any of our financial programs through NJ Save, the PAID pharmaceutical program, anything like that can provide some additional funds in sort of the pockets of the care recipient so that you can pay for respite services. But the governor is looking to expand the senior freeze property tax program, which is amazing, and looking to increase PAID and senior gold pharmacy assistance programs by another $10,000. They went up this year by $10,000. They're looking to do that again for January 1, 2024. And in the proposed budget, we're also looking to expand the number of home health aid hours that are available through statewide respite care program and JACK, 2 of the programs I mentioned before. And we're looking to create a caregiver hub for all sorts of caregiver information, including caregiver training. That was a recommendation of the Caregiver Task Force. So let's hope these things from the budget go through. So contact information for that county Office on Aging, you can always just Google them, Bergen County Office on Aging. The information will come up, or you can use this toll-free 877-222, and it's covered on my screen here, 3737 number, or you can go to our web pages and you can get in touch with your county Office on Aging. We've got a variety of hotlines, including for Medicare counseling and the PAAD pharmaceutical assistance. And you can go to NJ211 for some general social services, and that's our website. And we've got some other web resources. So these will all be available to you after the presentation is sent out to everyone. So thank you so much. Again, here's some of our contact information, and I really appreciate everybody's time today. Thank you.
Thank you. Thank you, Jen. If you could just leave that up a minute so that people can write down the numbers. We do have a couple of questions. So someone put in that they hear many caregivers say their loved ones won't put up with or they refuse respite care. They're worried that nobody will know what to do. Is there anything to say or do in these cases to reassure them?
Absolutely. One of my favorite things to do, and this is something that can be done, say, through the statewide respite program or even with MLTSS, be there when the person arrives. So if the person, if you've got another person, whether it's a friend, a volunteer, a home health aide, or whoever coming into the home, have them meet your care recipient first. See if you can check them out, make sure that the personalities match. That fear of the unknown is terrifying. Also, having the person know the backup, hey, I'm going to be here, but you know what? Also, my sister is going to be available to you, and she's going to be calling and checking up and making sure that you're okay while this other person is here. You're not alone, and this is the time that I am coming back. Having that not be known is really scary.
Mhm.
especially if you are that sole caregiver. One of the other advantages to respite care, and in my own career, I've found this particularly with adult daycare services, is that providing care through other people is really important, because the care recipient can get because of that insecurity, can become very latched on to you as the one caregiver.
Mm.
You're the only one who makes the world make sense and make me feel secure. So the earlier and the more frequently that you can have care by other people, the better. And it can be very tough to kind of ease into that, but it's very important to do as early and as often as possible, because at some point, chances are, whether it's a hospitalization or they need more care in the home or they have to move to a facility, they're going to need to learn to get comfort and
Mhm.
communicate with other people,
Mhm.
other caregivers. And so respite is a good entree to that, but easing it in, be there when that person is coming, even if you're staying there the entire time. So it's not really a respite that first time, but it's teaching that person what to do and how to do it, making sure that they are getting along with the person you care for can be really, really important.
Thank you.
Mhm.
And then another question was, somebody said they thought that MLTSS and respite care were mutually exclusive.
Statewide respite is a separate program from MLTSS. So if you're on MLTSS, you cannot be on JAC, you cannot be on statewide respite, you cannot be on the Alzheimer's Adult Day Services program. And the reason is that MLTSS should be providing your caregiver needs. And quite frankly, not just the services for your care recipient, but the services that are separate for caregiver respite are much more robust. That is by far our most robust program from both angles. So if your care recipient is on MLTSS, you need to talk to your care manager. If you're having difficulty with that, call your Office on Aging. They can be very helpful in advocating with you with the managed care organization. The statewide respite care program, JAC and Alzheimer's Adult Day, you can switch between those programs, but you can't put them together. Because they do provide respite services and we don't, and they come actually from the same funding source, which is state funding. The state of New Jersey, actually through Casino Revenue Fund and our general state budget, fund those three programs in their entirety. They're unique programs to New Jersey, and they've been around for a long time, and we're very proud of them because nobody else does what New Jersey does. Go New Jersey.
Thank you.
Sure.
Then-
If you are on community Medicaid, not MLTSS, but community Medicaid or Medicaid through DDD, through the Division of Disability Services, you can use the statewide respite care program. So we can provide certain services that Medicaid doesn't do. We can do those programs under the statewide respite care program.
Okay. We had a couple of questions on senior free, some really good points made there that I will talk about later. We will be doing work with the senior freeze when that time comes around. And the last question we'll do now, I'll save the rest for later, is since there are so few JAC or PEACE programs, hold on a minute. We have any idea on when they will be expanded? Some counties have a hold on new JAC applications. Do we have any idea how long that hold will last?
Most counties right now do have a wait list for JAC, unfortunately. Okay. However, we expect that to be relieved no later than July 1. Terrific. And county by county, if they have some additional funds available, as people naturally come off the program, usually onto MLTSS, for the expanded services, then your county may be able to add on. That's one of the other reasons why, if really the care need is for a break, then statewide respite may be a better program for you. And we really don't have a wait list in any county for statewide respite. And if the service that's really needed and the person is daycare and the person has that cognitive impairment, then Alzheimer's Adult Day Services, which does 5 days a week, which is way more than Jack, could be the program for you.
Okay. Okay, thank you.
Sure.
Okay, if people can put in more questions and we'll get to them later. We'll do our best to answer everything, but right now we're going to move on to Ellen Maughan. Ellen is part of the New Jersey Paid Outreach Collaborative, and she's going to talk about, and I'll probably get this name wrong, so you can correct me, the family leave insurance benefit, which is a rather recent program, and I think a lot of people haven't heard of it yet. So this is a wonderful program, and it'll probably be the first time that a lot of our audience is learning about it. Go ahead, Ellen. Thank you.
Hi, thank you so much. Thanks, Jen and Lauren, for fantastic information. And I'm delighted to be here today to give you an introduction to the paid family leave program in New Jersey. Now, we often hear in the news about how the United States is one of the only developed nations that does not provide paid leave for new parents. We hear a lot about that, but we hear less about paid leave for family caregiving. Unfortunately, we're also one of the few countries that provide paid leave for family caregiving. But the good news is actually that New Jersey has had a program. It's not new, actually. It's been since 2009. However, the benefits and the duration of the leave were expanded in 2019. However, still we know that many New Jerseyans are not aware of the program, or they think they don't qualify for it, or that it only covers new parents or women after childbirth. And we know that program utilization is particularly low among low-income workers. So today I'm here to talk about New Jersey's paid family leave insurance program and its coverage for those of you who care for sick family members. So paid family leave and wage replacement programs provide numerous health and economic benefits to the state. First of all, they strengthen families' economic well-being. They also help to address racial and gender inequities in health, in the workplace, and in earnings. Certainly, the paid leave for new parents improves maternal and child health, and that's available for fathers as well. And these programs provide many more benefits. For employers, there's also great value in paid family leave. These programs help to increase employee retention, which reduces turnover costs. They certainly improve employee health, lowering long-term healthcare costs, and boosts employee productivity, morale, and job satisfaction for employees who are able to take these benefits. Employers do not pay out of pocket for these benefits. These wage benefits are funded, but through paycheck deductions. The employee pays for them themselves. These paycheck deductions are paid into an insurance fund. Your employer does have a cost in terms of having to figure out how to cover your work while you're away. But if you're not away for a very long time, the costs are very minimal. Even if you take the full leave, the costs are nothing compared to the cost required to the employer if they were going to hire and train a new employee to replace you. These reduced turnover that occurs in employment means reduced costs in terms of hiring, training. And we can't underestimate the value of that boost in employee morale and productivity for those employees who are able to take this leave. So it ends up being a win-win for employers. There are three purposes for which workers can take New Jersey paid leave. It can be caring for a loved one, as we're talking about and we're focusing on today. It can be for bonding with a newborn child, bonding with a newly adopted child, or bonding with a child who is a new foster care placement. And also can be taken for coping with domestic and sexual violence. The person who is the survivor of the violence can take it, and the person who is caring for them can take it. For family member care, FLI, family leave insurance, may be taken to care for a family member or loved one with a serious health condition. And I know Lauren already touched on this, very similar to the FMLA. A serious health condition is defined as an illness, an impairment, or physical or mental condition that requires inpatient care in a hospital, a hospice, a residential healthcare center, or continuing treatment or continuing supervision by a healthcare provider. So it's in a facility, but out of facility as well. In that, and it's a condition that requires continuing care and oversight by a healthcare provider. A healthcare provider must certify the serious health condition. Healthcare providers that are included and are able to certify claims include medical doctors, certified nurse practitioners, chiropractors, dentists, psychologists, and more. There's a whole list on the New Jersey Department of Labor website. Who are loved ones whom we can take FLI for to care for? Well, the definition in New Jersey is very expansive and inclusive. We can use FLI to care for anyone whom we define as family, as chosen family. It can be an unrelated auntie or a neighbor who relies on you for support and care. The law says it's any other individual that the employee shows to have a close association with the employee, which is the equivalent of a family relationship. So it includes not only the child, spouse, parents, siblings, grandparents, grandchildren, in-laws, domestic partners, any blood relation, chosen family. You typically don't have to provide supportive documentation of the relationship, but you do need to be close enough to this person to be able to have that contact with their doctor, which may mean that you need to file, HIPAA forms in the doctor's office so that you can be in contact, so that the healthcare provider can speak to you. And that was with the healthcare provider who needs to certify the claim. So who's eligible? Well, almost all employees working in New Jersey are eligible, regardless of the number of employees in their workplace. And I know this can be a little confusing. We're going to touch it back on FMLA at the very end of my presentation. But here it doesn't require, there's no cutoff based on the number of employees in the workplace. Most employees are eligible if you'd be looking for that FLI deduction on your paycheck. However, occasionally there are eligible employees that are not seeing an FLI deduction on their paycheck. And that's because their employer has misclassified them. So sometimes the only way you can know for sure if you think that you should be eligible is actually to go ahead and apply. You must have a valid Social Security number. Exemptions from eligibility are New Jersey federal government employees, out-of-state employees, and workers who are not technically employees, such as contractors, independent contractors would not be eligible. To qualify for family leave insurance in 2023, there are income requirements. So you must have worked at least 20 weeks, earning at least $260 per week, or have earned a combined total of $13,000 in the base year. And for purposes of FLI, the standard base year is the first 4 of the last 5 completed quarters that you worked before taking leave. Your employer has to report to the state quarterly on your wages. Last is the 4 of the last 5 completed quarters for your base year. The benefits that you'd be eligible for are paid at 85% of the worker's average weekly wage, with a maximum weekly benefit of $1,025 in 2023. That just went up from 2022. And benefits may be taken for up to 12 consecutive weeks, or they can be taken intermittently as well. And if you take them intermittently, it would be 56 days you'd be eligible for. So as I said before, New Jersey Family Leave Insurance is funded only by worker payroll deductions. However, your employer must set up FLI payroll contributions. If you're an eligible New Jersey employee, you'd be qualified to take FLI. Some employers will establish a private plan. It is an option of theirs, but that state approval of that plan is required to ensure that all employees are really getting the same level of benefits. So for the employer's role in setting up family leave, as we talked about, they need to set up the payroll deductions. They can certainly support workers in applying, and They must be actually, according to state law, displaying posters with information about FLI and other laws, other worker laws and worker programs. They should be displaying those posters in the workplace. You may see them in a designated spot in your work setting. Employers must also provide written notice of FLI benefits when the employee is hired, when the employee requests information about them, or when the employee notifies the employer that they have a need for medical family caregiving leave, basically. The DOL can request additional information from employers if it's needed, but employers are not responsible for otherwise filling out any part of the FLI application. So let's just kind of summarize the steps that you need to take advantage of FLI paid family leave benefits. First, you need to inform your employer. Now, we know that sometimes the need for family leave arises very abruptly, but in that case, you need to give reasonable leave to the extent that you can, as far in advance as you can. Or if it's intermittent care that you're providing and you know that you're going to be taking certain days for care, you need to give at least 15 days of notice for that care due. The next thing you should do is visit the myleavebenefits.nj.gov website. That is the New Jersey Leave Benefits portion of the New Jersey Department of Labor and Workforce Development website. There you can file 100% online, and quite honestly, that's what's recommended. It's also possible to file on paper and to fax in an application. However, most likely your claim will be handled more quickly if you file online, and it's easier to track your claim. You can start your application online 60 days before taking leave, or you can start at within 30 days after starting the leave. You also need to have that healthcare provider certify the application for caregiving leave. The healthcare provider certifies the loved one's condition in Part C of the application, and the healthcare provider's portion is completed online. But it's the person seeking leave. It's their responsibility to nudge the caregiver, to provide the information to the caregiver, to notify them that they've applied for family leave. And then when the caregiver applies, they get an ID number, which they will give to the healthcare provider, so that the healthcare provider's portion and the caregiver's application can be linked together. It's really important, as I said, that if you can apply online, those claims usually process faster, but it's important to plan ahead as much as possible and consider your financial needs, recognizing that it can take somewhere between 2 and 6 weeks to process a claim. This is just a slide showing the Department of Labor and the My Leave Benefits website, and shows where you can click on to start a new application. There's also additional places you can click on, information for employers, for workers. There's handouts, information for healthcare providers as well, and more information about the many other wage replacement programs, some of which we won't be talking about today, including temporary disability insurance and earned sick leave days. Just need to touch on other related programs and laws. And of course, this piggybacks on Lauren's presentation. Lauren gave us some good information about FMLA and how to take advantage of that. And I'm just talking about it in my presentation with regard to the job protection benefits that FMLA provides. So there's two ways. I mean, it's so important. It's one thing to get wages while you're on leave to care for an ill family member, and it's really wonderful. But we know that some workers are afraid to take FLI benefits, paid family leave, because they're concerned about losing their job or losing the prospects of a promotion. So we know that additional protection is needed to ensure that you have your job waiting for you when you return. And here are two laws that can help. Lauren gave us some great information already about the FMLA, and I will just be repeating what she's already given us. But I want to also indicate that New Jersey has a separate law, the New Jersey Family Leave Act. It's confusing, I know. FLI, FLA. but this is the new NJFLA, also provides some job protection. And that covers workers who have worked, like for FMLA, you need to have worked for an employer for at least 12 months. You need to have worked at least 1,000 hours in those 12 months. And you need, the employer has to have at least 30 employees or is a government entity regardless of size. The main point to remember here is that eligibility for FLI or paid leave is already covered based on earnings. I know it's a little confusing. There's ways that we can help with that confusion, but want you to know that there's separate laws that help you with that job protection part of it, so that you can feel like you can go on leave without that worry that you're not going to have a job when you get back. More about preventing any sort of retaliation. It's unlawful for an employer to retaliate against a worker for taking leave or seeking to take their FLI benefits. And this retaliation would include being fired, reducing your salary, suddenly increasing oversight over you on your job duties, changing your workplace responsibilities, excluding you from meetings. I'm sure there's other ones you could think of, but these are just some examples. If retaliation occurs, your remedy is to file a complaint with the New Jersey Division on Civil Rights, and they have a process on their website. Or you would even have the right to take private legal action, which means filing a lawsuit in Superior Court in New Jersey. I just want you to know there's materials out there that can be of great help on the New Jersey Department of Law website, on the New Jersey Division of Civil Rights website, which enforces FLA, the job protection part, and New Jersey Time to Care Coalition / Caregivers also has wonderful information. We have this infographic that was cut off a little bit on the left-hand side there that can be shared on social media with your organizations as well. There are many websites also where you can find additional information, and you'll have these available as well when you receive copies of these presentations. But the New Jersey Paid Leave Outreach Collaborative, NJPLOC, is where I'm a member of and doing this work. The state government, the DOL website is myleavebenefits.nj.gov. The New Jersey Time to Care Coalition has been working on this for years and has really great resources on their website. Here, the next is the website for the New Jersey Division on Civil Rights. The second to last one, NewJerseyTimeToCare.com Get Support, is actually a place where you can book an appointment for FLI guidance. Particularly the work of Yara Willman-Cole, who's really spearheaded this effort for so many years, and her team actually can provide you with some one-on-one assistance. So you can go to that link for that sort of support. And there is a Facebook group, New Jersey Families for Paid Leave, where there's lots of scenarios presented, and you can post a question or a scenario where you need some help. And that's really what I wanted to cover today. I'm available for questions as well. Thank you for your time and attention.
Excellent, thank you. So the only question we have right now is why don't federal employees get to take advantage of getting paid while on leave? I don't know if we know the answer to that.
I can talk a little bit about that.
Sure.
The problem is a state and federal government conflict of laws, actually. There's lots of, in New Jersey, if we have a state law that provides more coverage, the state law governs. However, federal government employees are not actually governed by state law in many of these worker situations. So it's really unfortunate. There is the FMLA for federal government workers, and that while that is unpaid, and that's quite not a big help for many people who can't afford to take unpaid leave. I understand that there's some other federal employees who I believe, and I shouldn't say this, but I think that there are some other programs that may come into play with federal employees, but it's unfortunate that they're not covered by the state law.
Thank you. Any other questions? This has been excellent presentations and a lot of information. We will send out the recording link and the slides and some of the links. Jen put some links in the Q&A. I will send those out as well. And also a lot of the things that you all pointed out, I'm going to add to our website at njaaw.org. we have a resource page, and we're always adding new things for it, and we're really expanding our caregiving webpage. So I want to thank everybody. Ellen, if you could stop screen share, is going to bring up more information on the open house for the adult daycare center. And I think that you answered everything so well. There are no more questions. Okay, I am just having a problem sharing this page. There we go. So as we went over adult daycare, Parker Life is having an open house for their adult daycare program on Saturday, April 22nd. I'll send you these flyers as well when I send out the links to the recording, which is a growing option for people to have the respite care that we talked about. And I want to thank you, Jen, for presenting such a sense of calm when you were talking about respite care, because I think that is something that we all need. So with that, if there are no more questions, we will wrap this up. I want to thank the three of you for being here today. And I want to thank all of the speakers that have been in this series. I want to thank our audience for joining us. This has been really, really helpful. And we are going to be doing more work with caregiving throughout the rest of the year. So please stay tuned. We will email you about any events, and we hope to see you at our next one. Thank you very much for joining us today.
Thank you very
Bye,
much.
everybody.
Thank you, everybody, for your time.